we are back with another episode of Middle Age Mamas. The gang's all here, and we also have someone very special. You know, Middle Age Mamas, we have tons and tons of resources,
Yes.
but this one comes straight from the Smith house.
Yes.
We have Dr. Smith here, Don's husband.
Hello.
Also known as Dr. What is it?
Soul Bro.
Dr. Soul Bro.
Solebro.
On TikTok, he is a podiatrist and also an ankle and foot surgeon and knows everything about our wonderful feet. So he's going to fill us in on what we should and shouldn't be doing at this middle-age stage. Okay, so the burning question is plantar fasciitis.
Okay.
I've actually had this, and it goes and it comes and it goes and it comes.
Right.
It's the most excruciating pain that comes out of nowhere, and then it will leave. But
Right.
mainly in the middle of the night when you're getting up to take your middle of the night pee.
Oh.
My foot is
I don't
completely.
even know what that is.
Right.
Yeah. Can you
Yeah,
explain? Yeah, I'm sure plenty of middle-aged moms know because
Yes.
this is a struggle for us.
I don't know.
Right. Well, you know, it's a chronic condition that definitely happens when you're relaxing.
Uh-huh.
When you relax, all the ligaments and tendons seem to tighten up when you lie down. And then when you go to stand up, everything stretches out, and that's when you feel the stretching, the pulling, the tearing of the plantar fascia, and that's what.
Oh, that's a
causes
thing?
Is it
That's a thing in your bottle?
Absolutely.
Oh,
I didn't know that.
Absolutely.
Oh.
It's a ligament that connects the heel to the ball of your foot.
Oh.
And when you stand up, your foot naturally elongates, and with that stress, it causes microscopic tears in the plantar fascia, which can cause inflammation and pain.
Do they heal or do they just?
Yeah, that's something that will eventually go away on its own, but it's better when you wear supportive inserts to support that plantar fascia.
If that don't
prevent-
sound like
Well, when do you
middle-aged,
feel
I don't
this?
know
When
what
do you
is.
feel like you said
Well,
when
you
you're
know-
getting up and you just your foot planted
Yeah,
on the ground?
it's-
Right.
It's
So
one of
it
those-
comes and goes. So
Mhm.
there's a season like in the summer where I'm wearing sandals and all of my shoes are flat and unsupported. So then it comes on where it's your heel, like you said, is on fire.
Right.
But it's mainly in the middle of the night. But it also can be during the day. And a lot of middle age. I don't know. Does it happen in your middle age? Why is it a surprise?
Well, you know, as we mature,
I like how you said
our ligaments and tendons lose their elasticity.
Oh.
So it becomes less flexible,
Uh-huh.
so it's more fibrous.
Oh.
And so when you stretch that area, if it's not flexible, it's going to cause inflammation. And
Okay.
therefore that leads to pain. But what we should do is just stretch more as we mature.
Oh, so stretch your feet.
Stretch your calf muscles,
Uh-huh.
and that will lessen the stretch on the plantar fascia.
Okay.
Yeah.
So
the
when
looser,
Okay, go ahead.
the looser your calf muscles, the
Mhm.
looser that pull will be on the ligament.
Got it.
Yes.
So it has nothing to do with the shoes that I wear?
Well, it can.
Okay.
Absolutely.
And
Does
so
she
when
wear
it comes and
flat
goes,
shoes?
does that have to do with the shoes that I'm wearing in that season?
Yes.
Okay,
yes.
so if I wanted to stay away forever, then
Mhm.
wear more supportive shoes and then
Supportive
flex.
shoes.
And
Yes.
why am I doing it now under the table?
So you know,
I got
most
a ballerina foot.
people have a flatter foot type,
Mhm.
and so you need to support that plantar arch with some type of insert. You don't always need a custom insert, but you need something that's going to prevent your foot from flattening out so much.
Right.
Right.
So no more sandals?
Well, you know, you
Or
can
not
do
flat,
it,
flat,
but
flat sandals.
but if you're going to walk 3 miles,
Right. You're
You're
gonna
gonna feel
suffer.
it the next day.
Yeah.
yeah,
So it's normal that it comes and goes.
absolutely, it's
Okay.
a chronic problem that's self-limiting. It'll resolve on its own eventually,
Okay.
but it can be painful getting to that point.
Yes.
Yes.
Okay, so I have a question.
Mhm.
This is from a listener. So she has a toe fungus,
Mhm.
and she's actually had her toe fungus for a year.
Oh,
I
my.
think, yes.
Okay.
Off
What
and
is
on,
that?
like she'll put drops on it
Right,
or
right.
like try to soak it, vinegar and
Mhm.
water or something
Mhm.
like that. She said that she has been doing, but she can't sustain it because she just doesn't have enough time, I guess, to keep like soaking her feet
Right.
all the time. Anyways, what can she do to like remedy that? She got it from the nail shop initially.
Okay.
Oh,
Well, what she can do is first we can obtain a sample of the nail to confirm whether it's fungal, bacterial, or just from trauma. Because micro trauma can cause disfigurement of the nail or thickened dystrophic
Micro
nails as
trauma,
well.
like her foot in her
Just
shoe.
from the nail, hitting against the end of the shoe, or somebody stepping on your nail. So that's what I do in my practice. I'll take a sample of the nail. Once we get it back from the lab, if it confirms there's fungus, you have options, topical and oral. So the safest are topicals, but if a patient is healthy and we do a liver panel, then we can give them PO or oral medication to resolve that.
But what are your thoughts on pedicures?
Don't say no.
Well, no.
And what do
They're
you
good.
see, like when you see women coming in, because I know the majority of your patients are diabetics and you're dealing with, major kind of wound care and
Right.
trauma.
Right.
But what do you see from women going out getting pedicures? Like, what are some of the issues? Because I know you give me a hard time. Like one time,
And I go
I
every
know,
2 weeks.
and I invited him once. Like, oh, let's go and get a pedicure. He's like, I ain't trying to go get a.
And can I add to what Don is saying?
Yes.
Also, when I go and get my pedicures at the nail shop, the bowl that they soak your feet in,
Right.
is this okay? I think it's okay. I think it's better than just being in a regular bowl. But they have a plastic covering, and they put the water inside of the plastic covering. So is that
Yeah,
what
are they
protecting
protecting
concerns?
Yeah, I think
what are the concerns?
what they're doing with that is after your session, they're removing the plastic and putting a new one there,
correct.
just to prevent cross contamination. But if you're happy with your current pedicures and you're problem free, then it's okay. If you do, have a problem, then come see us.
Oh, so you're saying we shouldn't go hop all over to different places, find
Stick
something
to
you
one
like and
person.
stick to
Stick
it.
one.
Oh, that's
stick
good.
to one that you like, and I would say it's okay.
Okay, because I have a ratchet place and then I have a bougie place.
now, for my diabetics, some pedicurists are more aggressive than others
Right.
when getting into the corners and all that, and they can
Right.
cause complications, which can lead to amputations, which I'm doing every day.
Wait a minute, because the people are diabetic,
Right.
and they went to get a pedicure, then they
get
gotta
an
get.
infection. It
Oh,
gets into
wow.
the bone, and then I'm removing a toe or half a foot.
Oh
Yikes.
wow!
So,
Wait, I just had a random thought. What do you do with that toe? Where does the toe go when
right.
you take
Well,
it?
it
Burn
goes
it.
to pathology, and they do their
Burn it.
examination. But it's funny you mentioned that. A lot of my patients, for religious reasons, they want their toe
They
back.
keep it.
Oh.
Where they?
Absolutely.
What do you? What would?
They want it back, so I tell them just to talk to pathology. But
And they'll have to go get it from the.
and they have to
from
get it
them?
from
Because
them.
what is their concern? They want to make sure
What would you
nobody's
do
trying to
with
do like
it?
some voodoo.
Well,
with
a
their
lot
toes?
of patients want to be buried with
With
all
all of
their
their
body
10
parts.
toes.
Ah.
Wait.
Yeah.
Oh, so that's a religious preference to have
Yes.
all your.
Right.
Your
all
toes
their body
on.
parts.
Ah.
That's
Interesting.
very
So
interesting.
I've had quite a few patients ask me for their toe or half of their foot back, and I said, "Well, you need to talk to
What did they
the
do with
pathology."
it?
Well, they
In the meantime, though,
they
you
leave
put
it
it
in
on
formalin.
ice.
They leave it in formalin,
Oh, okay.
which will preserve the tissue until they do whatever they're going to do.
Cause, okay, so then what do they freeze it? Like if you were at home, like a person who took your half of your
that's,
foot
that's the
ice cream
$1 million
and they have
question.
a foot.
Yeah.
That's crazy.
What's that?
So they put it like in their freezer. And
Maybe.
No, he said they put it in the juice.
They
and
have
then like
no,
a
but-
jar.
Do they give that to you from pathology? Will they give you
They
the
may
formula
give it
that
to
they?
the patient.
Oh,
Yeah,
okay.
but
Yeah,
I've
it's
never
just floating in the
right in the
That
formalin.
at home.
Yeah.
They probably
Yeah.
put that in a freezer too, huh?
They
What?
might.
What black people always want to put everything in the freezer?
Because it preserves.
Hey,
Why
yeah.
we automatically want to put it in
Right.
the freezer? Like
But,
Next
it's
to the
a big-
macaroni.
But it's the nail shops are good. Some may offer antifungal nail polishes to give to the client. But you know, if you're not using an antifungal polish, you know, take your own polish or buy your own polish, because the polish that they're using, if it's not antifungal, they're using it
everybody.
So should we be asking, is that antifungal?
Yeah, or
Or
just,
standard?
your own
just
polish.
say, hey, I want brand new.
Is OPI just naturally antifungal? Like, can we look at the brands?
It has to say antifungal
Oh,
in there.
that's
you
a
know.
good
And
tip.
we offer
Wow.
that in the office, or just buy a brand new nail polish.
And bring it.
Yeah,
Right.
because the instruments are usually pretty clean.
Right, because they come in that little bag and they
Right,
stick it
right.
in
It's
the.
the
They
polish
sterilize
that
it.
they're dipping on everybody's nail.
Right.
on
So
your
that's
toe.
what mostly causes the fungus on your toes,
I
on
believe
your
so.
nails?
Yes, yeah, not from the
Wow.
instruments, because they're pretty clean.
Oh, that's
nowadays.
interesting. I would
Yeah.
have never
That's
guessed
why
that.
I take my, like if I'm going for pedicures, I take my base, my color, and my top
Mhm.
coat.
Oh,
So
That's the
Yeah.
safest approach.
Mm-hmm.
Yeah.
Oh, okay. That's very helpful.
But it,
What about the cuticles? How often should they cut those, and is it okay to be cutting our cuticles?
you can cut them. You know, I'm not sure on the frequency of it, but you know, everything kind of varies from there. But how often do you get yours done?
Like once a month, or in the
Yeah, I
summer,
mean,
every
that's fine.
couple weeks.
As long as they're cleaning their instruments, you should be fine.
Okay.
But I think the transfer of fungus is from the nail polish.
Interesting.
Yeah.
I would have never thought of that.
Now, do we have a billion nerves on our feet? Because why does it tickle so much when they scrub underneath?
know, right?
It's so tickly.
They're just hypersensitive, and the reason for that is, you know, your feet are so far away from the brain.
Uh-huh.
They need to be hypersensitive to let you know that something's wrong.
Oh.
Okay. So, and that's the problem with what I see with my diabetics. They lose that hypersensitivity,
Mhm.
and they don't know if a nail is in their foot or not.
Oh.
And that gets them in trouble. Yeah.
Wow.
Yeah. So the nerves are hypersensitive. The blood vessels are smaller.
Mhm.
So diabetes affects that, which limits their chance of healing
Mhm.
in severe cases, which leads to amputation.
Yeah, my dad was a diabetic, and I do remember, he's passed on now, but he used to take extra special care of his feet, like
Mhm.
even getting them cut, like at the doctor's office.
Right,
That's
right.
Like how
Every
serious
couple
he
of months
was.
or
Yeah.
Oh, because he
Right.
didn't want to get an infection.
Yes, absolutely. Because, like he said, it's very hard for them to heal, like,
Mhm.
period, you know,
Right.
but their feet especially.
Right.
Right. So a common cause of amputation is diabetic. So that's
Oh, yeah.
that's
Yeah.
the main thing.
That's primarily what I see every day. I mean,
Oh,
I'm
wow.
doing some form of amputation daily,
Wow.
unfortunately, whether it's a toe or half a foot.
What's the
Yeah.
nationality of people? Does it matter? Is it more black people?
You know,
White
it's
people?
yeah, black and brown for the most part.
And it's because of our diet, you think?
It's
or?
from diet and lack of education or lack of resources.
Wow.
You know, a lot of the patients are fearful for seeking medical care
Because of the cost, you think?
for the
They
cost
don't
and
wanna
for the
know.
fear of a below the knee amputation.
But if you
Yeah.
don't know,
But if you
then
don't know,
of
right.
course that's where you're headed.
You know, just limited access to healthcare providers, especially for a podiatric surgeon as myself, and you know, access to vascular surgery. A lot of docs will say, "Hey, let's just do a below the knee amputation because that's the easiest and most definitive procedure."
Instead
to
of
get
trying
rid
to
of.
figure out how you can do
Right.
it and
Or
keep
he'll try
the
to
or a
save
limb
it.
salvage
Try to
type
save it.
procedure. Yeah.
Yeah.
So, you know, when I see a patient and they have a pretty significant infection, you know, they're already waiting for a below the knee amputation. But when I tell them, oh, I just need to take this toe and you can save your foot, they're like, wow.
And that's
okay.
good that you try to save
Right.
as much of their leg or foot
Oh,
or
absolutely,
whatever. Because who
absolutely.
really wants all of that, you know,
Nobody.
cut off if it can be
Right,
saved?
right. And you know, what a lot of physicians, I believe, forget about is you have to treat the patient's psychological health not only the
Because that's an
physical
issue
health.
once you start talking about amputation.
Absolutely.
And
you know,
after.
You take somebody's limb and they become depressed.
Yes.
And so then they have a failure to thrive.
Right.
So I take that into account. You know, even when I have a patient with infection involving their entire big toe, I can do a procedure where I remove all the infection and they still have the flesh of their big toe. Afterwards, they look down and they still see their big toe. It may not be very
I
functional,
was about
but
to say, can it still move?
they're still whole. Yeah, and actually it will move. So, you know, thinking of the patient's whole body experience and psychological health is very important.
Well, how did you come to that? Like, how did you figure out I can save more of this person's limb or toe or whatever
You know,
versus cutting it all off? Like, is that
Right.
just your experience, or did you go to a special continuing education class for podiatrists to figure this out?
You know, it's just from my experience because, you know, my background is in psychology.
Oh, okay.
And so going through medical school or podiatry school, you know, I was looking at
The whole person.
the whole person, and you know, everybody that I performed an amputation on, they became depressed. And so I said, man, how can I remedy that? And so I started basically deboning the big toe and clearing out the infection. And when they, after the surgery, they look down and still see their big toe, they're happy
Yeah.
because they're like, man, I look
I thought this was
normal.
gonna be
Yeah.
gone.
I can still walk,
Right.
you know, whereas most of my attendings would just remove the big toe. And, you know, psychologically, they're like, man, I'm not whole now,
Right.
you know. So that part of my background, the psychological background that addresses their emotional, psychological health, I implemented that into my medical practice.
That's
good.
fantastic.
And it's been working. You
Yeah.
know, it's not.
Has it increased your patient load?
You know what? It actually has, and patients are very appreciative of it.
Right.
Because I'm
Yeah.
sure they're referring you.
Oh,
That's
absolutely.
crazy.
They're like, oh man, Dr. Smith, you know, he can save your toe. You know,
Yeah,
blah, blah,
Dr.
blah.
Smith.
You know,
That's amazing.
so you know that's what I do in my practice. So you know, it's not textbook, so to speak.
Right.
But you know, one of my attendings said, you know, treat the patient. Don't treat X-rays or the textbook. Treat
Right.
your patient.
Yeah,
Right.
that's good advice.
You know.
Right.
So, and it's been working.
Yeah.
You know, if the infection is bad enough where I need to remove all the soft tissue and all that, then so be it. But you got to think of the patient's psychological health, and that's what I do.
That's good.
Yeah.
So speaking of psychological health,
Mhm.
we still like wearing heels.
Oh my goodness.
Getting rid of your heels in your 40s is
Right.
not good for you.
Right.
But why is it that we can't walk in our heels anymore? I feel like I'm 13 and starting all over again. The balance is off.
Right.
Is it time to give them up, or when should you stop wearing
Definitely after
heels?
COVID,
You know,
we was wearing
it-
flats
it-
all over the
girl.
place.
My take on it is, if it hurts, stop doing it.
Right.
Okay. If it hurts, stop doing it.
But
Because-
sometimes you have to sacrifice.
Yeah.
If you're a little
For your
different.
outfit.
or you know, limit your time in those shoes.
Okay.
You know, you can
Yeah.
wear the 2 and 3 inch
Two.
heel pumps.
You talking about 3
That's a
and
kitten
4.
heel.
Hey, get your picture and then get back into your flats. Okay. Otherwise, you're gonna keep me busy. You're
You
gonna
talking
keep
about
me busy.
long-term effects on your feet and
Well, you
toes?
know, it can cause a lot of problems such as inflammation, capsulitis,
Bunions.
bursitis, bunions.
calluses. You want to-
Calluses. You know, they're just, you know, the foot is not designed to be in this position.
But my arch
Damn
is
it,
really
Barney.
high. My arch is really high. Why isn't my foot designed for that?
Right,
If you
right.
have a really high arch and you're kind of comfortable, let's say you can walk in 3-inch heels all day.
Yeah.
That's how
Well,
you feel.
If it's comfortable, then that's
What he said, as
go
long as
with
it doesn't hurt, it's
As
okay.
long as
Oh.
it doesn't hurt, you're good.
Okay.
Yeah.
Well, I think you talk to me more about not only the heel or the height of the heel, but you always also talk about the toe. Like if it's something that's really narrow or pointy,
Oh,
that's
right,
gonna be,
right.
you know.
A lot of women's shoes basically converge at
Yeah,
the toe,
squeeze.
and that naturally causes you to become more prone to a bunion. And that's a subtle dislocation of the big toe joint.
And so is that why that bone is like
Mhm.
sticking out?
Absolutely. And
Wait, so why do people have to have bunion surgery?
because of
You
the
can't
pain
just have bunions?
from it, yeah, you can live with bunions. But
Oh, okay.
But you
when they
still-
become more,
I think I'm confusing between bunions and corns. Corns are the ones
That's
that.
on top of
so
your toe.
corns are just like a fancy term for a callus, a painful callus.
Okay.
And typically on your toes, on your knuckles,
Uh-huh.
on the bottom. But you know, you can get a corn, I guess, on your bunion also.
Ooh.
Yeah.
But the bunion, I think too. I think more about, was it more like dancers? Like you see a lot
A lot
of
of
dancers,
dancers,
and it's that big bunion, and it kind of
right.
And you said it's the
relocates.
bone.
Yeah, it can
With a
override
bunion
the
and a
second toe
hammer.
or go under.
What's the hammer toe?
The
Like,
hammer
what's
toe
the-
is when your toes are kind of cocked up like this.
And you're born like that though, right? Because if you have long toes.
No, I mean
No.
it's something that
Turn into
develops
hammer
over time.
from
Yeah,
from the type of shoes that you
yeah,
wear, right?
You can be. It can be genetic in the type of shoes that you wear. You know, flat foot individuals can develop them. Even high arch individuals can develop bunions or hammer toes. It's just the flexor tendons tend to overpower the extensors, so
They start curling.
they start
up.
curling and don't allow you to straighten out.
Oh.
Yeah, bird feet.
Okay, another thing. When I put on certain shoes,
No, you have so much feet problem.
Right.
I didn't realize it until he's in front of me. I'm like, oh, he's so smart.
It's like I got hammer toes now.
I don't have hammer toes. When I go to put on a shoe and I'm like pointing my foot to get into it,
Okay.
it like cramps up.
Oh.
And I have to like
That sounds like a
unjig-
Charlie horse.
Yeah, in my
Yeah,
toes though. I'm like, oh, and I have to
Yeah.
like shake it off and start again. And
Oh my goodness.
what is
You
that?
don't need to wear that shoe.
No, that's a tennis shoe though. Just pointing to get in the
Pointing.
shoe.
Then that can be from either overuse
Of my feet?
or just
You use it
What
every
you
day.
or weakness of your intrinsic muscles, which are the muscles between your metatarsals there.
It's on the
So-
sides, like
On the
when
sides.
they start to like
Yeah.
cramp up all
Right.
together.
It can be overuse or
Overuse.
yeah, it can be a number of things.
Overuse my toes.
What are
Yeah.
you doing with your feet?
Right.
She just discovered all these feet problems.
Man. Yeah, you may need to come see me. We're going to have to get some
I got that
X-rays and go
I
from
got
there.
that too, right?
But I think what's really funny is wherever we are, like
Uh-huh.
as soon as someone learns that he's a podiatrist,
Oh man.
everybody
They have
starts
all
taking
the-
off their
Hey,
shoes.
we could be at a
It
formal black tie event,
people
and they're
start
taking off their shoes
shoes.
inside.
No way! They're taking
Oh
off their
man,
shoes.
I'm like,
To
man,
talk
Shut
about-
Like this,
Yeah.
doctor.
Yeah.
Wait, how do you get out of
Everywhere.
that? Because you're so polite and so kind. What do you say? You sit down on them?
I just say,
No, I'm good. I don't.
I
get
just say, do you
involved.
really want to take your shoes off right now? You know, come see me on Monday.
Oh.
No, but usually it's too late,
I know.
and he'll just say,
In the
He's
middle of
really
dinner.
good. He's really good about it, and it's been happening, forever.
Oh,
But
my
it's so
gosh.
funny that you don't realize
Uh-huh.
how many issues people have with their
Yeah.
feet,
right.
Yeah.
or they just don't understand. I know we know a lot of people that have bunions, especially women, and we're concerned about the appearance of it. We want to be able to look cute in our shoes, and so when I do overhear these conversations, and Dr. Smith is really good about saying if it doesn't hurt, don't bother it.
Right.
And
Just
I
leave it
think
alone.
that's one of the things that because of vanity, we're wanting everything to be pretty, but you don't realize that sometimes when you have surgeries, have procedures done, it can make it worse.
Right.
And
right.
if you don't have any pain, that's the one thing I get when I'm listening
Right.
is that if it's not causing you any pain, don't bother it.
Don't
Oh,
bother.
Yeah.
just keep your
Just-
corn.
yeah.
Or don't
Leave it
those
alone.
Dr. Scholl, I don't really get bunions or corns or anything like that,
Mhm.
but don't those Dr. Scholl things work? The little stickers that
Those
you
little
put?
pads.
Oh, they don't work.
Well, I mean, some of them
It
do.
can cause more
Some of them
problems.
do, but a lot of devices out there can cause more harm than good.
Okay.
Especially if you're diabetic.
Mm-hmm.
But my thing is, if your sensation is intact, your circulation is intact, and you use some of those devices and it doesn't hurt, then keep using it.
Yeah.
Yeah. So, I mean, there are some good devices out there. I mean, I don't want to use any specific names
Right.
out there.
Mm-hmm.
But for inserts, I would say stay out of your typical pharmacy for the inserts.
Oh, stay out of it.
Yeah.
And get
So
a-
like
Go-
order them like custom
Go
or
to
something.
custom is good. Go to your Foot Locker, your Dick's Sporting Goods,
Oh.
Big Five, because the ones in the pharmacy, the theory is good,
Mhm.
but the materials aren't.
Oh, like the made
Not-
on for
not
TV
made
ones.
well.
Yeah, I see it on
Material.
TV.
So you're not really getting a quality device.
Mm.
Yeah, and I hate to mention any names right now, but you guys can hit me up on Dr. Solbro.
Yeah.
Oh, okay.
I can tell you
Dr.
specifically
Sobro.
what I'm talking about. But again, if it helps you, then go for it.
Right.
Otherwise, there are a lot of gimmicks out there that try and take your money
Mm-hmm.
and aren't really helpful. So, just consult a foot and ankle surgeon, and they'll give you the right information.
Is there a certain kind of tennis shoe that you recommend?
Oh,
Can we say names?
absolutely.
Like that help your feet the best?
Absolutely. My favorite are Brooks,
Oh, okay.
New Balance, Asics,
Asics.
yeah, Saucony, and even Hoka.
Yeah, I was gonna say
Oh,
those.
yeah, those are
That's-
really
that's a
popular
good
right
one.
now.
That's
too.
a good running shoe, right?
Yeah,
Oh,
absolutely.
I didn't know that was a running shoe. I thought it was just strictly like a walking shoe.
No, they have runners also. They're a pretty good shoe. Just because a shoe is expensive doesn't always mean it's good.
Oh, right.
You have to do certain tests for a shoe. For a flat-footed individual, if you can easily twist it in either direction, it's not a good shoe for you. And if you can fold it easily from the toe to the heel and it breaks in the heel or in the arch area, it's not good.
So how is it when you take your kids' shoes off?
So,
How is Dr. Smith?
oh yeah. I tell them, this is not good. That's
It's
not,
not
good.
good.
Do they run up and down the aisles and all
Oh
that
yeah,
stuff?
No.
I have my timer on. Say, oh, you're faster with this shoe. No,
No, but
But,
it's not fun. It's not fun for me because I'm all about a deal.
Right.
If it's on sale, I'm like, you can.
Oh man, she's
we-
buying them Chuck Taylors.
We-
man.
Flat.
Man,
So,
I'm like, are you
I-
serious?
And he's saying he's not saying names, but he will say names that are not allowed. So the kids will like all of these different styles that everybody is wearing.
Right.
And so if I'm the one doing the shopping, which typically is the way it works,
Right.
they're better off going with him because he's not going to be concerned about
The price.
the price
Right.
as
Right.
much as I am. Like, I'm looking for a deal.
Right.
When he comes home and my son will have $150 tennis shoes, and I'm thinking to myself, you could have gotten 3 pair of shoes at Ross or what. So I'm very much about the deal.
Right.
But what happens when he's with us, even if it's for me, he'll take a shoe and I'll say, "Oh, honey, what do you think about this?" Like, I'm about to start working out. He'll take that shoe like in the
And
store.
start folding it
He
up.
will fold
Right.
it. He will twist it. He'll be like, "That's trash. It's garbage. It's
That's
garbage."
right,
Garbage.
And I have to do the same with the kids. Like, when the kids start asking stuff, I was like, you know what? You're not about to get me in trouble with your daddy. So no. I'm gonna say no. But there are some things that they want. They want
Right.
to wear Converse and they
Yeah.
want to wear Vans. All of the things that, and the reason, I'm sure you can say more, but that it doesn't provide the proper support.
Right.
And so what he did do for us as a family is we did all get custom orthotics. Like, he came home and
At what age?
molded everybody's foot and took it into
Oh,
the
this was a while
lab.
ago.
It was
Right.
it was
Wait,
years
or
ago.
so kids can wear orthotics
Oh,
too?
absolutely.
Oh, I didn't know
Yeah,
that.
and I have very flat feet, and and I don't know, do the kids have flat feet too?
Yes, pancakers.
Okay,
Oh,
so
wow.
they have flat feet as well.
Flatters.
But you said that's hereditary too, right?
Yeah, absolutely.
So so we have flat feet, and he made sure we all had our orthotics. And so if we're choosing to wear these shoes that are not the best for us,
You can just
he would
slip
just
in.
say,
Right,
as
right.
long as you're gonna, if you're gonna continue to wear those garbage shoes, as long as you wear your
Right, put
orthotics.
the
So
inserts in there.
that's the way.
That's my compromise.
That's the
Oh, okay.
compromise.
Yeah.
But it,
So like a
it's
Converse
our-
with the insert?
right.
yeah.
Yeah,
Mm.
yeah.
And
'Cause-
I love, like, I have some, I don't wear like just regular old Converse, but I do have some Jack Purcells that I like. And
Yeah,
so
I mean,
do you.
they look good.
Yeah, and
right?
I like them, but
Right.
I definitely will wear my inserts, my custom orthotic, because
Did you
otherwise.
guys get those for Christmas?
Right.
Easter.
No. He's not giving out orthotics as gifts.
That's funny.
But yes, that's the way. But it can be a tad stressful going shopping.
Mm-hmm.
Now, did your kids wear baby shoes?
I have a question
Yeah,
about
Oh.
this.
They did.
Is that
But not
now
like- not
kids
those
don't wear
hard
them
white
anymore?
ones.
Not the hard ones.
No,
So-
no.
Do you wear baby shoes? Should new moms put their babies in baby shoes when they're learning to walk? Because I've always, just being an educator and taking care of a million kids, I've always said teach them how to walk barefoot so they can
Right.
feel the ground and
Yeah,
learn
all
their
that
balance.
proprioception.
Right. So which is it? Is it baby shoes or barefoot?
I would say I would lean towards barefoot.
Oh, okay.
You know, because those hard,
Yeah, those
Where
hard
did they
straight
come
flat
from?
I have a
shoes
story. I have a
What-
story.
are not good.
Where did that come
I
from?
have no idea.
So when I was a baby,
Uh-huh.
I was severely pigeon-toed, right?
Okay.
And so I had to go to the podiatrist. They made molds of my feet, and I
Right.
had special shoes. I had those hard bottom
Yeah,
shoes,
right.
little
Yeah.
booties,
Yeah.
and they were on a bar.
Okay.
And so initially, I wasn't
okay.
supposed to
I
walk.
see.
I was supposed to just be, sitting
Right.
and just
Right.
let these things get straighten my feet out.
Oh, okay.
And so, do kids do that these days? Or
Yeah,
do
if you
podiatrists do that
have,
still?
yes, if you have certain deformities that we're
Uh-huh.
trying to correct,
Uh-huh.
they still do that. A lot of times I'll cast the patient or
Uh-huh.
the infant.
How
but-
old were you when you had that?
I was
bar?
an infant, I maybe one.
Oh.
Okay.
Is it? Didn't you get them off in the crib or something one time?
Well, no, I would just walk. I was just walking like a
Mm.
zombie.
Yeah.
Do you have memories of that, or is it
I do. I still have memories of that, and
Yeah.
that thing is hanging around somewhere at the house. But yeah, well, I remember it was a bar, those shoes, and they were screwed onto,
Right.
and the toe was cut out so that my feet could grow out of the shoe.
Oh, wow.
Okay.
Yeah.
Yeah, you know-
They must have been pretty expensive. I don't know.
You don't see it that often these days, but they have used those in the past. I don't see it a lot now. Mainly we cast the infants. We catch it earlier now. We just cast the deformity out.
Okay.
So
So they wear a cast on their feet.
yeah, and
Oh.
they'll come see us every few weeks or so.
Oh, so they're keeping in for a number of
yeah,
weeks.
yeah.
Because how would you know? Because our middle daughter was extremely bow-legged.
Mm-hmm.
Remember?
I
Of
remember.
course you remember. But she outgrew it. Like she was totally
Oh, yeah.
Like parentheses, huh?
yeah.
Oh, yeah.
For
She
instance.
was
She
yeah,
looked
like a
Scatman
wishbone.
Crothers.
Yeah, she
Wow.
but she totally outgrew it, and we didn't do
I didn't
anything.
know that you could outgrow.
Yeah,
it.
her
Well, I
legs-
guess if she's growing
Her
straight
legs,
up.
Yeah,
her
yeah.
legs just straightened out. But
that's interesting.
how would you know, like as a parent, if you see that happening?
Mm-hmm.
You just take them to the pediatrician and they say this is
Yeah,
a
I mean,
deformity, or this is let's
And
just wait
could
and
you
see.
wear braces on your
You
legs
can.
to fix that?
But a lot of times it will straighten out around age 4 or 5. Yeah, and if it doesn't straighten out, that's when you.
Then that's
gotta-
when you want to be concerned.
That's when you want to be concerned.
Yeah.
Because is
That's
there a
when the teasing
disease that's
starts.
associated with that? A
There-
bone disease or something?
Not necessarily a bone disease, but sometimes children are overly rotated inward or outward, where they have either an external rotational deformity, or internal rotational deformity. But typically they'll outgrow it around age 4 or 5.
Mm.
Once they've reached, say, 6 or 7, and they're still walking abnormally, then you want to look at maybe bracing or surgical intervention at that point.
Did we ask what causes that? Bow legs?
You know, it's just
Your daddy
something
was
that
bow-legged.
naturally, yeah, it's just something that naturally happens. You know, when we're born
Yeah.
as
Bow-legged like his
infants,
daddy.
everybody is pretty much externally rotated, and then sometimes when you're developing, the body naturally internally rotates. Sometimes it just over rotates, and then you can have torsion of your tibias and all that. So it's just development. You know, you have variations and.
Because I would always be overly concerned.
Right.
And he would always be very calm.
Yeah.
And it'll be fine. But
Right.
I was very dramatic,
Yeah,
possibly.
she
Well, he knows.
You didn't have the comfort
of
knowing
this.
Dr. Smith was in the house.
right.
It just, no, because there were, I mean, for different things. Like I think about the daughter that was bow-legged. He was like, oh, let's just wait and see. And so I was okay with that. But then there were other things that would happen that I would just be very concerned about. Like that same daughter had one of my ears and one of his ears.
Oh, yeah,
Different ears.
Yeah,
Really?
like
That's
one, like
fascinating.
one ear that is
That was
like
kind of curled
curled,
down.
and then one that's up. So she
Right.
literally has like one of my ears and one of his ears.
Oh, that's
I was
interesting.
taking her to the pediatrician, like trying to schedule plastic surgery.
Figure it out.
Yeah, I was like, she needs to have plastic surgery, and the doctor
Was
looked
it
at
that
me.
noticeable?
Oh yeah.
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 She had two
Because it
different
was-
ears. Like
right.
one was folded down and one was up, and I was like, we need to do something about this.
So
like,
what they do?
Nothing.
He said, no,
They
Oh,
said,
she-
they
turned
said,
into
Mom,
Yeah.
Ah.
they
Yeah,
just
it
they're
worked
like,
And then
itself
her
out.
hair.
yeah, I mean, I mean, I haven't looked lately.
No,
but
it's
still-
fine.
it's
It's fine.
still the same.
No,
Like,
no, that's fine. They're both
They're
symmetrical.
both
They're
the
the
same.
same?
Yeah.
Yeah.
I
oh
don't
my
know
goodness,
that.
I'm so awful. I need to
Yeah.
go look when I
Yeah,
get
they're
home.
symmetrical now.
So we had that I was ready to take her for plastic surgery, and then when he was cutting our son's hair for the first time,
Uh-huh.
Oh man.
this dude had a hook head.
Oh, I
That
remember his head.
Was
Yeah.
so, and he had these cute little curls, like this little
And all
curly
the hair was
curl.
covered.
And he was a year, he maybe a little over a year, and he was getting his first haircut. And I started hyperventilating. I saw the hook
She was like,
appearing.
put it back.
I was like, what's happening? What's up? What is that? What is that? What is that? Put it back! Put it back!
What is it, hair back?
The hair back.
She wanted me to
Like,
put the hair back.
Stop right there! Like
Yeah,
it
he
was.
I remember that hook.
That
We
hook.
looked at a picture of him the other
Oh,
day,
yeah.
and it was a profile.
He was sitting on the
Yeah.
hair.
Yeah.
Yeah.
That hook was
Oh yeah, yeah. He's got a lot of
mean.
brain.
That
Yeah.
that hook
Yeah,
was
he's
so
smart.
mean.
He's
It took
smart.
us a very long time. It took him a long time just to grow into it in
Yeah, it took a
general.
while. It took
Okay.
about
'Cause that-
13
So
years.
it's not as hookish anymore.
It's not as-
It's
not
not
hookish
as
at all.
prominent. It's not
No.
as prominent. But again, I was freaking out, and Martin just sitting there with the clippers like, like, and I'm like, you don't see that? Like, what is
Hey,
really?
yeah.
And I was trying to figure out, like, I think we always, as parents, when the kids start acting special or looking special, we try to figure out, like, who we're gonna blame it on. Like,
Hey,
What's up?
those are her jeans.
whose
you know?
jeans?
Hey,
Whose jeans? And so I'm like looking at
your mama
him.
jeans.
I'm contacting his parents, like, who in
You
your
just
family
needed somebody to
has-
blame.
Right.
It's already
Right.
there.
Right.
What they gonna do?
I'm wanting to know who did this to my baby. Who had, and so it was so funny. Many years later, my brother, who's right under me, he mentioned, she's like, oh, so I see he has my hook, and I was like,
It was
it's
both sides of the
Yeah.
Oh man, Travis. You talking about Travis?
yeah. But he's always very, very calm. I don't think there have been any medical issues with the kids where you didn't react in a rational way.
Irrational way, right?
Right.
What made
I know. I
you-
said
I'm
where
sorry.
you weren't rational.
Oh, okay.
Yeah.
What made you want to become a podiatrist?
Mm.
You know, it was one of those things where I didn't know what I wanted to do.
Yeah.
You know, I was looking at dental school because my sister's a dentist. I was looking at medical
Oh,
school.
right, the Huxtables.
Oh,
But
yeah.
you know you wanted to be a doctor.
I
Some
knew I wanted
sort.
to be a doctor from like
Yeah.
3rd grade.
Oh, wow.
You know, I was able to map out the oxygenated and deoxygenated blood throughout the entire body in
Really?
3rd grade.
Really?
Yeah, I drew I
Wow.
made drawings and all that. So I should have been a cardiologist.
Wow.
Right?
Yeah.
But you know, when I was preparing for medical school, I took the MCAT and I started getting all this information about different specialties like chiropractic medicine, dentistry, you know, you name it. And I didn't know
Plastic
much
surgery.
plastic.
I wanted
yeah.
you to be a plastic
I
surgeon.
didn't know about yeah.
Really helped me
I
out.
didn't know about podiatry. I thought it was part of the MD umbrella. And when I
Oh.
found out that they had their own specialty school,
Uh-huh.
and then you're guaranteed to be a surgeon.
Ooh.
So I looked into that, and it was one of those things where I went to an informational. And
You fell in love with it?
yeah, I was like, well, why isn't this information out there in the colleges and
Right.
the high schools?
Mhm.
So and part of the prerequisite was you had to shadow a podiatrist before applying to
For
school.
how long?
You know, maybe a month or
Okay.
so. So I did that and saw that this one podiatrist was saving limbs, saving lives, preventing below the knee or major lower extremity amputations, and I said, man, I want to do that.
Wow.
You know, so it happens that I went to this informational and I was talking. I ran my mouth a lot. Okay, so I happened to meet the dean of admissions, the president of the university, and they said, you know, Martin, I like you. You should apply. I was like, oh, okay, I've heard this before.
What school is this?
It was called the California College of Podiatric Medicine in San Francisco.
Oh, okay.
Yeah. Now they're California School of Podiatric Medicine at Samuel Merritt University in Oakland, California. So I applied, and long story short, got right in. And I had also applied to medical school, and you know, so I got accepted to podiatry school right away, and I was tired of teaching at the time. I was a teacher for what was it, junior high science and math. I was like,
Oh, wow.
I
Was,
said,
it was tough then?
yeah, I said, let me go to podiatry school.
But he was so good. We need
So-
more males.
Black
Yeah, you know, I
males
was
especially.
more of a mentor,
Yeah.
Okay.
and that's what those kids
They need
needed
that.
to you know
They
they
need
need
it.
somebody
Especially our
to
boys.
listen to them, talk with them without any judgment.
Mm.
You know, and even my worst students they recognized my car. They used to come knock on my door.
Yeah, it was in Inglewood.
in
Oh, when you
Inglewood.
guys lived in Inglewood?
Yeah, and just I would go out and just talk to them.
Aw.
Some of my
Yeah.
worst students, the gangbangers, and they
What
just
school did
wanted
you work
somebody. I was at a school called Warren Lane
Oh, yes.
in Inglewood,
Mhm.
Yeah, yeah.
and you
Maybe
know,
we'll tell.
that's what our kids need. They need somebody just to listen, talk to them without any judgment. You know, but where are we going with this?
But why did you choose? And I think another
So-
another
Yes.
reason,
Yeah.
if you don't mind,
Mhm.
was that you were wanting to have a regular schedule.
Yeah.
You were wanting a family. You didn't want to have to
Right.
be on
The
call.
doctor said it was
You
crazy.
didn't
Oh,
want,
it's
yeah.
nuts.
And so you had spoken to a doctor too that said, you know,
Yeah.
it's not all about the money.
Right.
Make sure you have time for
Oh,
your family.
work-life
Yeah.
So
balance.
you were looking at a specialty that was gonna allow you to do like
To-
And
to
were you
Nine
guys
to
married
five.
while he was in school, right?
Yeah.
No, we were
Towards
towards the end. Towards the
Yeah,
end,
but
yeah.
not
But we were
initially.
together for years prior to this,
Right.
and so that was one thing. You know, he knew he wanted to be married and have a family and not be gone all the time.
Right.
And so that was part of it as well.
Mm-hmm.
You know, wanting to be able to come home, and I mean now he's working 7 days a week and all day.
Yeah,
but
yeah,
that
yeah.
But
was
everybody's almost
Yeah.
gone.
Everybody
yeah.
wants that.
and that wasn't always the
Dr.
case.
Smith treatment.
Right.
Yeah, that
Right.
wasn't always the case. He was, you know, at a hospital before where he, you know, 9 to 5, come home, not work on weekends.
Right.
But LA's a little different.
Yeah, LA's a little different.
LA's
you
a
know,
little different.
in private practice,
And in private practice.
you're pretty much always on call.
Mm-hmm.
You never know when somebody's going to be admitted,
Right.
and you know, this is what I do. You know, if somebody needs help, you know, I'm here to help them and try and save their limb.
And he has his special
and save their limb.
patients that only want to see him.
Yeah,
And
you know,
they kind of show out, and they
If he doesn't show up,
Right.
he's not
Really?
there. Yeah,
Right.
if he's
They're
not
like,
there.
where's Dr. Smith?
Yeah.
Show
Oh,
I
up.
ain't
man.
needing nothing.
I ain't talking to nobody but Dr. Smith.
Right. Yeah, I
That's
have
good
a
though.
few.
That says something about you,
Yeah.
about your
Well,
service.
you know, I hope. You know, I just want to make a difference.
And just representation matters as
Absolutely.
well. So
Right.
it's a lot of black male patients that are concerned about some other doctors, like
Not
Martin,
treating
like
them
he was
the
saying,
correct way.
or they're
Yeah.
wanting to just do extreme amputations
Right.
where they feel like he cares about them, that he's not going to butcher them unnecessarily, and he has a good rapport, and you know, so they love him. But what I love, there's a story that I remember from a few years back. There was this old lady, I think it was maybe an old white lady,
Mm-hmm.
and she came in, and you had seen her when you walked in. She was like,
Oh, was this up in press?
She was flirting. Yeah,
Oh,
this
yeah,
old,
yeah, yeah.
this old
Girlfriend.
lady.
Yeah,
Yeah,
I
she was
forgot
like,
about that.
So
Yeah.
then after he saw her,
Mm.
and she said, "Oh," and he's like, "Okay, I'll see you next time." She said, "I'm gonna tell all my friends.
Right.
I'm gonna tell all
Oh,
my
man.
friends about you, and tell them my doctor is tall, dark, and
Yeah,
handsome."
hey, she had all the golden girls.
So I love
Hey,
it.
that's
I
all
love
right.
it.
I love geriatrics too.
So he takes good care of them.
You know, it's
You
just
know.
you do your best. You know, it's just providing a service, and I'm just happy I'm here to help.
We thank you so much for stopping by. You're our first male guest.
Oh,
the
okay.
first male voice that you will hear.
Okay.
So
Oh,
we're
I
so
feel
honored
special.
that you came
a
by.
middle-aged dad.
But to
Yeah.
take us out, what are 3 tips that you can give just women or middle-aged women
Mhm.
to take care of their feet going forward?
I would say, tip number 1, stretch.
Okay.
Stretching is really good, really therapeutic for the body, especially as we mature, because our tendons and ligaments become less flexible, and we want to kind of stretch them out and prevent any injury.
Okay.
Good nutrition,
Okay.
high protein if your kidneys will allow.
High protein.
Drink plenty of water.
Okay.
Yeah,
And should we
stay
be walking
hydrated.
or running now at this point?
And I would say
On a treadmill or just flat, straight walking outside?
walking is always good. If you run, maybe do it on a treadmill.
Okay,
It
so
has
run on a
little
treadmill,
bit of-
walk outside.
But wear a nice supportive shoe, running
Get
shoe.
some hookah.
Yes. So the shoe gear is so important.
Okay.
A lot of patients will do this minimalist thing, but you have to train your foot to accommodate that. to
Right.
get
So you
used
need
to
to be
it.
supported.
It's the only pair of feet we
Yeah,
got.
right. Because the
Get into
arch,
the head.
if you have a flat foot, all the stress goes up your body. The arch is designed to be the shock absorber of the body. When you don't have an arch, you get ankle pain, shin pain, knee pain,
That's from the arch
hip,
support.
lower back. Yeah.
Oh, that's from the
So
arch.
it's a domino effect, and that's why we promote wearing a supportive insert and shoe to prevent.
Good information.
I love how
Yeah.
passionate you are
Yeah.
about it.
Yeah, it is.
'Cause I
Well-
remember once you told me I was having some pain. I think maybe it was my ankle, and I asked you about it, and you said, "Oh, it's probably because you have poor posture." And I was like, "Dude, we've been together for over 20 years, and this is your
How
first
you tell
time
me
telling
I'm
me
slouching?
that I have poor posture." But
Oh yeah, how should we be sitting?
Yeah, I
Just
mean-
up straight
Up
up.
straight,
Okay.
I mean, I don't
I
know.
think
not
my
leaning
posture
over.
in general,
Just
even just
straight up.
walking, was probably poor. I'm imagining that's
Yeah.
what you were saying.
Oh, and I bet the listeners want to know: is it okay to get your toes sucked?
Hey.
Remember the other doctor said
Yeah.
that the
Yeah,
bacteria
Dr.
in your
Tony.
mouth it can be dirty.
Right. Hey,
Coming from
my-
the podiatrist, is
Right.
it okay? If it don't hurt.
Absolutely.
If it
Just-
don't hurt.
Hey, just use the mouthwash afterwards.
Oh,
Hey, you know?
that's what you said.
I did.
You wash your mouth out.
Hey, y'all don't want to go there with me.
I thought we were talking about booties
Hey.
with the doctor.
No, because she said,
E. coli.
yeah,
Oh,
when
that's
she talked
good.
about the bacteria in our mouth.
Oh, is that
Oh,
right?
yeah.
Yeah, as long as you brush your teeth and mouthwash.
Dr. Smith
Okay.
doesn't mind a good cough.
Hey, I'm a nuke. You know,
Oh,
hey, you don't want to go there with me. But you know, I need to be mindful.
Always.
I need to be mindful of who the audience is.
Okay.
My kids
We'll,
may be
we'll,
watching.
we'll end on that note. Thank you so much for
Thank
stopping
you.
by
You're
and
welcome.
taking care of our girl Dawn.
Oh,
It
my
is
pleasure.
endearing to see love last this long.
Yes, man.
And all the
Biggest
great
thing.
stories.
It's been a
I'm
long
his biggest fan.
time.
Why you say it so long?
No, I'm just saying.
A
You know,
good long
It's been a
time.
long
it's been,
Lord.
well, we've been married for 22 years.
Right, we here.
But we've been together almost like
Almost
30.
Oh, look at him getting the math.
Yeah.
he's
But
so
she's just so special.
Yeah.
And
talented.
and talented
Aw.
and smart,
Aw.
and I wouldn't have it any other way.
Aw.
Oh, thank you, Martin. Ah,
Wait, wait, wait.
black love, everybody. Black love.
Black love.
Wait a minute. One more time. Put one in my hand.
More time. This is
Oh.
the X-rated
He's
show.
so sweet.
Push the button.
He's so sweet.
Before,